To begin with, we're concerned about TB in general. 1 out of 3 people in the world are infected with the germ that causes tuberculosis. Of those people, over 9 million people will go on to develop disease each year, and nearly 2 million of those people will die. Of the people who have TB disease, up to 40% of those are children in some countries. Disease in children is more serious than disease in adults. A huge part of actually containing childhood tuberculosis relates to education. Educating not only parents, but educating healthcare providers and politicians. In many countries in the world where they have very high burden of TB disease, those are also countries that have very limited resources to be able to put into healthcare. And in those countries, the burden of TB can pull healthcare dollars away from many, many other competing needs. The tuberculin skin test that many people have had, a simple little test on their arm, can tell us reasonably well if a person's infected with the germ that causes TB. It's not perfect, and sometimes it overcalls infection. So if you have that vaccine, which in many of the countries with a lot of TB disease, everyone's vaccinated, well, your test might be positive. It might be positive because of the vaccine, not because of the infection. So if you rely on the simple skin test that we've been using for over 100 years, you have a lot more people positive than are really infected. In the last decade, we've developed some very good tests that are much better at accurately diagnosing infection in adults, and we think they're much better in children. And we're doing a lot of work right now to make sure that they work just as well in children as they do in adults. The beauty of that is if we can decrease the number of kids that we want to try to give medicine to, it actually helps the public health systems quite a bit because they're treating a lot less people. It focuses resources more effectively, more accurately, so they have a better chance of actually being able to give medicine to that smaller group of kids. One of the things that I'd like to emphasize is that the science that we've done to advance tests is wonderful. It's wonderfully important that we'll be able to do a better job at identifying children with infection. But that's actually pointless if we can't actually give them the medicine to prevent them from getting disease. In order to get the medicine into kids and prevent them from getting disease, it takes a lot more than just the lab research. It takes a lot of advocacy and educating people and working with public health officials to make sure that people actually acknowledge that children are important and that their risk of developing disease is greater.